everybody, welcome to my video. I'm going to give you a simple overview of theatre roles that you'll find in the United Kingdom. This should be helpful for healthcare students before they start a theatre placement, and for anybody applying for a theatre job. You may be asked a scenario-based question, for example, linked to delegating in theatres, where you need to know about the different roles. So I hope you find this video helpful. Do give it a thumbs up if you do. So before I go through all the different roles, it's important to firstly think about a patient's journey through theatre, because the roles I'll be talking about will be linking to these areas. We call this period the perioperative period, and it's basically the time linked to a person's surgery, and it's subdivided into 3 stages: the preoperative, operative and post-operative stage, so before, during and after surgery. Person will be taken from a ward or a pre-op day case unit, wherever they're based. They'll be checked in at a theatre reception, and here they'll be moved to a bed or wheelchair, from a bed wheelchair to a theatre trolley. The World Health Organization Surgical Safety Checklist is used across the UK and globally for checks throughout each stage of the perioperative period. This is to ensure the person's safe and to decrease errors and to reduce the risk of adverse events. Once checked in through reception, the patient will be moved to an anaesthetic room to be anaesthetised. And you'll see in the UK we've got clearly defined areas across theatres that link to important stages in the perioperative period. There is a separate room for staff to prepare sterile surgical instrument trays and trolleys for the correct instruments for the operation. Theatre practitioner or scrub nurses and surgeons and people assisting the surgeon during the operation will be in a different room and preparing to go into theatre, where they'll adhere to the national standards for scrubbing, gowning and gloving for surgery. In the anaesthetic room, this is where the patient is anaesthetised. They'll be given IV fluids along with monitoring equipment such as pulse oximeter, ECG, blood pressure, etc. Given the medication to be anaesthetised, and once anaesthetised, the patient's moved into the operating room for surgery. In the operating room, you'll see scrub nurses or operating department practitioners that are scrub practitioners. They work directly with the surgeon, handing instruments to the surgeon, and you might see 1 or 2 scrub practitioners, for example. It depends on the operation. But as well as the scrub role, there's also circulating practitioners, the nurse or ODP. This circulating role is one that a person goes in and out of the operating room. They're the bridge between the operating room and the outside, provide additional equipment if it's needed. They might need to give updates to the family, and they support the surgical team. Once the operation is completed, the patient is taken to a recovery room to be monitored for any complications. They're stabilised with fluids, given analgesia, ready to return to the ward or day case unit or a high dependency unit if needed. So you can see on this slide all the perioperative stages where the patient's prepared, anaesthetised. Preoperatively, they move into the operating room, which is the operative stage, and then recovery room, which is the post-operative stage. So let's start with theatre support roles, and all these support roles are essential for the smooth running of theatres. Different employers in the UK might have slightly different job titles and job descriptions, but in general theatre roles tend to be pretty similar across employers in the UK. We start with theatre receptionist or clerk. They answer the phone, they receive people at the theatre reception desk, they receive goods, general housekeeping duties directed by the theatre manager or a theatre coordinator. Theatre receptionists or clerks may call for patients who may be on a ward or a day case unit. They may keep an overview of the lists of patients across theatres. So usually they have very helpful information for surgeons, theatre managers, people visiting the areas. They know who is currently in theatres and who's waiting to go in. They monitor theatre activity and the comings and goings in theatres. So they have a key information and they relay key messages across theatres. Theatre porter is similar to most hospital porters. They collect and return patients to their rooms following surgery. They also ensure that the theatre environment and equipment's fully functioning, clean and tidy. They'll collect supporting equipment. They might have to sort out cylinders of gas for surgery, for example, and they support staff with storage of equipment and getting rid of waste as well. Theatre support workers, sometimes called theatre healthcare assistants, some employers use different job titles. They have a range of areas they assist with that goes across perioperative care pathways, such as supporting anxious patients when they get checked in for their operation to help them feel calm and comfortable. Person may need repositioning. They might feel very nervous. They're meeting any care needs the patient has for toileting. They might have been sick, for example. They might need to get changed. They might have vomited. So they might be responsible for checking patients into theatre reception as well and preparing patients for their operation. Theatre support workers might help in the operating room, making sure surgical instruments and equipment are cleaned. They work closely with other team members. They might be asked to do a range of different tasks, moving patients onto theatre trolleys, bringing them back into the anaesthetic room or taking them to a recovery room. They might help set up theatre equipment, checking that it's working. They might act as a runner between theatres during operations to find additional instruments or additional equipment for a surgeon or an anaesthetist, and then cleaning the operating room after getting rid of clinical waste, and also being responsible for restocking surgical items. An operating department orderly, the main role is to provide a safe and clean environment and transport patients to and from theatres and between theatre areas. So they help move patients around hospitals. In contrast to healthcare assistants and support workers, they also provide they don't provide patient care such as cleaning patients or toileting needs, for example. So that's the difference really between an ODO, an operating department orderly, and a theatre healthcare assistant. Operating department orderlies focus on clean and tidy theatre areas, ensure the trolleys are clean after use. They ensure adequate stock levels are maintained in theatres. They again remove clinical waste if needed, linens, sharp bins within theatres, preparing for collection of or disposal of equipment, and maintaining stock and medical gas cylinders, returning empty cylinders to central stores. So these are just some tasks that the theatre support roles will have. So following on from support workers, some employers have roles between a support worker and a registered professional called assistant practitioner and nursing associate. Assistant practitioners have extended their knowledge and skills above a senior support worker, and they must have completed a level 5 assistant practitioner foundation degree. Assistant practitioners are not registered with the Nursing Midwifery Council, whereas nursing associates are registered with the Nursing Midwifery Council. A nursing associate can administer some medications on registration within the remit of their proficiencies, whereas assistant practitioners are not taught to administer medication during their foundation degree. So assistant practitioners differ from nursing associates. They don't just work in nursing either. An assistant practitioner can work under the direction of a physio and other allied health professionals, occupational therapists and dietitians. Assistant practitioner roles are work-based and employer-led. So different employers utilise an assistant practitioner in different ways. So if you see an assistant practitioner in theatres, do ask how the role is being utilised with that particular employer. Nursing associates bridge the gap between healthcare assistants and registered nurses. They support registered nurses and free them up to focus on more complex clinical work. They again complete a level 5 foundation degree, but it's a nursing associate foundation degree. They're members of a nursing team. They are also registered with the Nursing Midwifery Council only in England, and it's 2023 currently. There are standards of proficiency that set out what a nursing associate can do when they register, and you can check them on the check the proficiencies on the Nursing Midwifery website for nursing associates. Nursing associates are always work under the direction of a registered nurse. Most assistant practitioners and nursing associates have developed through an apprenticeship route, so you might see apprentices relating to these roles in theatres as well. If you want to know a bit more about the nursing associate role and the difference between a nursing associate and assistant practitioner and registered nurse, I have some videos on my YouTube channel that might help. So if we now look at registered nurse and operating department practitioner roles, both roles may support a patient through their perioperative journey, those stages in anaesthetic, operating theatre rooms and recovery, so before, during and after surgery. ODPs and registered nurses both work alongside each other, their roles complement each other, and if you're a student or a trainee nursing associate, sometimes it can be quite difficult to see the differences between the roles sometimes. They might be doing the same things in theatres on a day-to-day basis, and the knowledge and skills required in theatres for certain tasks, for example, is the same. So, for example, an ODP and registered nurse might both assist a surgeon in theatre, and they're adhering to the same standards to ensure instruments remain sterile throughout the operation. Often early career roles are advertised for both ODPs and registered nurses on the same advert, which again shows how aligned the roles are in theatres. So you might see an advert for a Band 5 theatre scrub practitioner that's open to ODPs and registered nurses to apply for. However, the ODP and registered nurse roles are different. They're registered with two different bodies. Nurses are registered through the Nursing Midwifery Council, and ODPs are registered through the Health and Care Professions Council. Both ODPs and registered nurses do a BSc Level 6 degree, but they have different programme content and proficiencies. There will be some module content that will be the same, such as acute care monitoring, basic life support, airway management, escalation. But nurses have a broader range of topics that's underpinned by the nursing process. So placements for student nurses will usually be a wider range, might go into medical care areas, not just acute care areas. ODPs tend to be placed in acute care areas, theatres, A&E, acute admission areas. And this is because ODPs will be working in theatres and acute care environments. So when you look at career options on registration, nurses can apply for a broader range of roles, or if they start in theatre, they can move to community settings, for example, later. So nurses have more career choices for fields, settings and roles, but ODPs usually do this degree as they're more interested in theatres and they aspire to work in acute care. I explained the differences between the roles and the different proficiencies in more detail in my YouTube video, so do check that out. And we also have student nurses and ODPs in theatres as well, who you might see who are doing either a full-time pre-registration degree, or some of them might be doing degree apprenticeships. Another career pathway for an ODP or a registered nurse is a surgical care practitioner, and you may see this role in theatre. They support surgeons before, during and after surgical procedures. A surgical care practitioner is a registered non-medical professional who has completed a Royal College of Surgeon accredited programme. You have to complete a national accredited surgical care practitioner master's programme to become a surgical care practitioner. Entry criteria in 2023, it may change in the future, but you must show evidence of an ability to study at level 7 master's level. You must already be qualified registered healthcare professionals. That could be a nurse or an operating department practitioner, and you should be at least 18 months post-registration, have 18 months post-registration experience. So surgical care practitioners are trained to undertake some surgical procedures under direct supervision of a surgeon. So they might also manage preoperative clinics and assess patients to ensure they're clinically fit and healthy for surgery, preparing patients for surgery, including venipuncture and catheterization, writing operation notes, taking notes during ward rounds. They may undertake daily ward rounds. They might formulate plans for patients post-operatively, including discharge and follow-up care, and prescribing appropriate medication. So do check those roles out, especially if you're interested in aspiring to become a surgical care practitioner. You're also going to see leadership roles for nurses and ODPs in theatres. So from an early career theatre practitioner role, I've talked about roles being across the perioperative pathway, preoperatively, anaesthetic, you've got your scrub roles, operating department, theatre practitioners and recovery type roles. And all of those roles, you might have a team leader role in one of those areas or be expected to work across areas. So a band 6 or band 7 senior scrub practitioner, for example, or theatre practitioner, a team leader nurse or ODP, a deputy manager or an anaesthetics practitioner, nurse or ODP. So these roles go across both registered nurse and ODP professionals. And theatre coordinator is an important role, responsible for the day-to-day management of the whole theatres. The role involves communicating with surgeons and across all the theatre areas and areas linked to theatres to facilitate a smooth patient flow. So if you're a student nurse or a trainee nursing associate, for example, you'll see theatre coordinators, and it's very helpful to work with a theatre coordinator for the day and looking at how they manage that smooth patient flow. They also have to deal with sickness, absence, managing staff and different skill mixes across several theatres according to the support worker roles that I've talked about and the healthcare professional roles. And the main purpose of a theatre coordinator is to ensure maximum efficiency in terms of using each theatre and deploying staff across theatres. They might also carry an emergency bleep as well. Then you've got theatre service managers, similar to most service managers across healthcare, who oversee operational running of theatres, act as a leader, role model, senior leadership role, and they're responsible for professional day-to-day clinical leadership and operational management of theatre departments. They're responsible for managing, organising, leading teams, assuring quality standards, maintaining financial budgets. And I have a playlist on leadership and careers in leadership, so you might feel helpful if you do have interviews in the future for any role. I've got a video on risk management in healthcare, where I go over all the different terms linked to risk management, clinical audit in healthcare, and quality improvement and quality assurance. So do check out those free videos on my YouTube channel. Other key professional roles you're going to see in theatres, obviously a surgeon who leads and performs the operation, and you might have a chance to be able to observe surgery. You'll see people assisting the surgeon, you'll see that circulatory role, the bridge between the operating room and outside. And you'll see medical students observing surgery as well. The anaesthetist role, a very important role. The anaesthetist is a specialist doctor who is responsible for providing anaesthesia to a patient in the operation. They have a specialist skills relating to pain management, so after the surgery as well, they'll deal with pain. Airway management, intubation. Preoperatively, they assess patients for their level of risk and determine whether they can have it. So an anaesthetist might say the patient's too at risk, that their heart is, they've got heart failure and that it's too unsafe for them to go for surgery, for example. It would be an anaesthetist decision. So a very important role. But they will also determine the best anaesthetic option. Should they have a general anaesthetic or a local anaesthetic? Or a regional anaesthetic, and the anaesthetist remains with the patient throughout the operation. They monitor the patient, treat any complications, and then post-operatively they remain responsible for the patient in the recovery area until the effects of the anaesthetic have worn off enough for the patient to go back to their ward area. Radiologists you might see in theatre as well. Diagnostic radiographers might use x-rays and other imaging techniques, sometimes during surgery to check the correct positioning of a plate or a wire, for example. And if there's a complication, the surgeon or anaesthetist might request an urgent image to see what's going on. So you'll also see radiologists in and out of theatres as well. So I hope you found this video helpful for an overview of roles. Do check out my other videos. I've got a video if you've got an interview coming up for theatre, and lots of videos on different aspects of career development as well. So I hope you find those helpful. They're all free on my YouTube channel. So I wish you all success in your careers. If you have any questions at all, do put them in the YouTube comments. If you prefer to DM me privately, you can DM me on Twitter or on my website. And if you're interested, I'm an author of 2 books, How to Thrive as a Newly Registered Nurse and How to Prepare for Interviews and Develop Your Career as a Nurse or Midwife. And you can see the links to my books in the description in YouTube.